Hi everyone, I'm Leo Rutherford. I'm a PhD candidate at the University of Victoria in British Columbia. I'm presenting today on behalf of the Progress team, some of whom are listed here on the slide. Our presentation today is entitled, Do we need an anti-bullying campaign? Experiences of negativity and sex-related body worries among trans and non-binary people after phalloplasty and or metoidioplasty. Our presentation today is about a few topics related to body image, stigma, negativity, and sex-related body worries. But before we get started, I want to ask you a question. What's the first thing you think of when you hear the word phalloplasty? What about metoidioplasty? If you're a trans person who's had one of these surgeries, maybe your own body comes to mind. If you know someone who's had one of them, maybe you think about their experiences. Some people may know nothing about these surgical procedures, and so nothing comes to mind. For a lot of people, however, it's likely you've seen something on the internet or you've read one of the New York Times articles that came out recently. In these places, you may have seen pictures of genitals just after surgery while they're healing, or heard words used without context, like Frank and Dick. You may also have heard people say these surgeries don't work or don't produce good results. I want to talk to you about all of this today. Our title asks if we need an anti-bullying campaign, and it's a bit cheeky, but is pointing to the issue of how words are sometimes used to describe people's bodies in negative ways, and that this can have an impact on how people feel. If you know much about the literature about phalloplasty and metoidioplasty, there's not much research about how body image after surgery is impacted by things like stigma, stereotypes, and discrimination. We'll cover some of this in our presentation today. The objective of this presentation is to share results from our project, patient-reported outcomes of genital reconstruction and experiences of surgical satisfaction, or progress, for phalloplasty and metoidioplasty. We'll share about a few topics, including changes in dysphoria and euphoria after gender-affirming genital surgeries, which, if you're not familiar with the idea of dysphoria, it's a feeling of strong uncomfortability with an aspect of one's body or one's whole body. Euphoria, alternatively, is a sense of joy or happiness with a part of or the whole body. We'll also talk about community negativity and sex-related body image worries. The data we're sharing today comes from our survey that came out in the spring of 2022. Sorry, I know what year it is, 2022. But we sampled folks from the US and Canada who've had phalloplasty and or metoidioplasty, and identified as trans, non-binary, or another word that they use to describe themselves. We collected survey responses from 219 people. And the data that we're sharing comes from just a part of our survey. It was a very long survey, so we'll be sharing some info from newly created questionnaire items and a scale that we borrowed from Transpulse Canada and Transpulse Ontario called the Transgender Specific Body Image Worries. I'll share a bit of our demographics before we get into the rest of our talk. Sorry we couldn't fit more information about the demographics here, but only 33 of our participants came from Canada and the rest came from the United States. Most of our participants were white and were queer or gay, pansexual, or generally not straight. The education level of our sample exceeds that of the average education level for both Canada and the United States, with 78% having a college or university degree and 30% having been to graduate school or having a graduate degree. About half, or 53% of our sample, are what we in the community often refer to as active process, which means someone is between surgeries, or they may be waiting for revisions, or they might have a surgery planned soon, like an implant. So getting into our results. First, I want to echo some content that already exists in the academic literature about the ways that gender-affirming care impacts body image. So we asked our participants about levels of dysphoria, generally and genital specific, and euphoria, both before surgery and after surgery. And we found that 94% of our participants said that their dysphoria decreased due to having surgery. Most commonly, before surgery, participants said they had moderate amounts of dysphoria and not much euphoria. After phalloplasty or metoidioplasty, they reported not much dysphoria and a lot of euphoria, most commonly. Participants also stated that they felt more comfortable in public bathrooms after surgery. So overall, as you might expect, dysphoria decreased and euphoria increased. and our participants generally felt more comfortable in their bodies after surgery. Over a quarter of our participants told us that they experienced negativity within the trans community due to having had phalloplasty or metoidioplasty. I'm surprised not more. Almost everyone I know or have talked to in the community has had negative things said to them about their bodies, either to their face or indirect messages on spaces like Facebook or in Reddit. 3 people even felt the need to comment about the level of negativity they've experienced in open text boxes. In one of the questions, we just had an open text box saying, is there anything else we should have asked you in this survey? And 3 people wrote in there about the level of negativity that they've experienced because they've had surgery. So we'll get into our findings about sex-related body worries. Here's a table of the transgender-specific sexual body image worry scale developed by TransPulse Ontario. In this, participants rate on a scale of 1 to 5, with 5 being the most, how worried they are about these statements when they think about sex. You'll notice in the table that outside of worries about another surgery, there are slight increases in scores of sex-related body image in our sample compared to the trans masculine participants from Ontario. If you aren't aware of the stigma, misinformation, or negativity that surrounds phalloplasty and metoidioplasty, you might be surprised by this finding. If you've been a recipient of this negativity or experienced stigma firsthand, you would not be. The questions asked in this scale bring up aspects of interpersonal dynamics. That is, they ask questions about an interaction between people, not just how a person feels about their body. These results tell me our participants worry about what others think, even if they're happy with their own body. When thinking about sex, our participants reported worrying that other people will think their body is unattractive, most highly in this scale. So let's discuss all of this a little further. Overall, our participants reported a large increase in feelings of happiness about their bodies and a large decrease in dysphoria. Our findings about sex-related worries are most assuredly related to the way that trans people's bodies are talked about, and more specifically about how the genitals of those who have had phalloplasty and metoidioplasty are discussed. If people debated whether your genitals look good enough, you might be worried about how a sex partner will think about them too. While the question, do we need an anti-bullying campaign, might sound harsh or reductionistic, October is anti-bullying month, and the sentiment echoed here is one of a need for change in the way that we talk about other people's bodies and the bodies of those who have had these surgeries. Thinking back to the ways in which people can, intentionally or not, talk about trans people's bodies that cause harm. People might call surgical scars unsightly, called phalloplasty penises frankendicks, or say our genitals don't look cis or pass. Speaking about other people's bodies in this way is harmful. Other literature about negative body talk is clear. Those whose bodies are talked about in harmful ways can experience poorer body image and even mental health challenges. So consider what you say before you speak about someone else's body. If you're a trans community member, let's say something when you witness someone else speak about phalloplasty or metoidioplasty genitals in a negative way. For the service providers or other practitioners who might be in the room, be aware of the language you use to describe genitals after phalloplasty and metoidioplasty, and educate yourself about outcomes. Misinformation and myths, such as the procedures don't work, negate the experience of those who find euphoria in having them. For some people, phalloplasty and metoidioplasty not only work, but are life-saving and bring much-needed joy. Thanks for listening to this talk. If you want to connect more, you can reach out via our website.